All right, hey, Real Talk listeners, have a very special episode right now. Obviously, everything on the news right now is the COVID-19 virus, the coronavirus, and so I thought it'd be important for us to call upon one of our own, Dr. John Bodner, who, of course, is the head of the Alpinestars Medical Team for Supercross. I consider him the health and wellness expert for the industry. He's a trusted doctor. No fake news here. He doesn't have any political agenda, I don't think. And so, John, welcome to Real Talk here. And, man, I'm really interested to pick your brain and hopefully get some information out of this for people that maybe don't like to watch the mainstream news and they want to focus on somebody that's a trusted person in their industry.
Yeah, well, I'm glad to help out. It's definitely different times. This has been a real interesting week, even in the emergency room. I worked last night, and yeah, it's gotten a little bit crazy. And I guess from what I've heard, we're shutting down some of the races, so that's definitely affecting all of us.
Yeah, that's going to be, something that's going to be on everybody's mind, and that's one of the reasons why I'm really happy to have you on here. So, Supercross Live and Feld Entertainment have already unfortunately had to cancel the Seattle Supercross. Now that was the city was outlawing any major sporting events, large gatherings and things like that. From what I do understand, well, just let me read this real quick and then we'll get into it. So this is from Supercross Live. It says, in accordance with the governor's restrictions on group gatherings in King County amid coronavirus concerns, the upcoming Monster Energy Supercross event scheduled on March 28, 2020 at CenturyLink Field in Seattle has been canceled. There's refund information if you go to the stadium website. The 13th race in the 2020 Monster Energy Supercross Series will be rescheduled. For more information, please continue to get real-time updates at supercrosslive.com. So, I guess my first question for you, as a medical doctor, emergency room doctor for decades, why are all these large gatherings and sporting events being canceled?
Well, one of the problems with this virus, it's if you look at it just like a regular cold and someone sneezes by you, you're afraid you're going to get it, and it's in that same type of family that it's very easy to get because it's spread by droplets. So anybody keeps sneezing, coughing on you, that type of thing, or they cough on an item and you rub your hand on it and wipe your nose, just going down down the railing, if you're going on the plane, whatever. It's easier to get, but the closer you get in contact with people, then you increase the number of people that you're exposed to. So it just takes one person in the crowd of 100 to pass it to all hundreds of people all on one time. So that's why the concern is a large group.
Well, and so what is it? It's COVID-19. It's coronavirus. Evidently, people have it in their system and don't know it, and doesn't affect people. Like, where did it come from?
Well, as far as they know it comes from China. They think it's from some type of animal, maybe, and it's mutated from what the coronavirus. That's why it's Corona-19. It's actually 2019, but they made a little buzzword with COVID-19. But it came from that area. We still haven't gotten like ground zero yet, like where it actually came from, but it has mutated some, so it's a different strain, and that's why it's a problem, because coronavirus is well known out there. Even Listerine has it on their ingredients of what their wives have killed for years, but it was a pretty mild virus. It's just like similar as a respiratory virus. It gives you a cough, runny nose, congestion, like that, but it wasn't so lethal. And unfortunately, this one is mutated to the point that it's causing a lot of what they call SARS type. It's a SARS virus now, where that affects the immune system, also respiratory, your cough, you can get pneumonia. So because it's mutated, none of us really have a big immunity to it. So that's the problem. If you've had one cold, you might get another cold, and it doesn't bother you as much, where if you go to a place where you've never had their colds, you get a bad, us who travel, we seem to get the colds when we go to another city. But it's not that bad. And unfortunately with this one, the way it hits your immune system and attacks the respiratory system, we just haven't seen it in our body, and so it takes us longer to fight it.
So I've been listening to a podcast by Dr. Sanjay Gupta, who is doing these podcasts for CNN. There's been about 10 or 11 of them, so I, kind of wanted to bring myself up to speed on it. And one of the things that one of the people from the CDC said was 80% of the people who are infected recover and survive. Just stay home, you know, you're going to go through the flu, and you know, it'll pass. Your immune system will fight it off. So, like, is it better or worse than the common flu? Why is this so elevated right now?
Well, it's probably more so because our bodies haven't seen this virus yet. So when it does hit us, it hits us harder. Our bodies aren't responding, so it keeps percolating, so to speak, in you, making mucus, causing fluid to build up in the lungs, then you get pneumonia. So when your immune system drops, you're at risk to get other things too, and pneumonia is one of the worst ones because that's obviously how you breathe through your lungs. So with the flu, it's fairly similar in the sense you get a fever, you feel sick, but it's been around long enough that even though there's different strains, we kind of know how it attacks you and how it works, where this one's so novel that we really don't know other than what we're seeing symptoms-wise. But in the realistic way you get it, just like any other cold, it's the same way you get it from another patient. And that's why, since we don't have a good response in our body, they want to keep as many people away from it as possible. That's going to be the hard part, just because we're such a connected society. And yes, it was China, but now it's in Massachusetts and in Seattle. It's starting to crop up in people all over the place.
Yeah. So are you on the side of getting a flu shot every year or not? Which some
100%,
people do.
100%.
Every time. Okay.
Yeah, I know people like, well, they said I got the flu afterwards or made me sick. They were going to get sick anyway. It had nothing to do with it. I mean, everybody can have an adverse response to any kind of shot or immunization, but the flu is. I had it when I was in college, and I'll never want to get that again.
Yeah.
It was horrendous. I'm all for getting the flu shot every year, and if you do get some subtle strain that's not covered, you tend to have less symptoms of the flu. So I'm all for that. It's, again, preventative is way better than worrying about it afterwards.
Yeah, for sure. So all of this nonsense that we see on the news, right? Is all this just an overreaction? I mean, these people that are buying out, a Costco buying them out of toilet paper. I thought you were only getting sick. I didn't know it was going to give you any lower urinary tract issues, but people seem to be, like the apocalypse is coming. Is that an overreaction?
Well, I think it's an overreaction in the way it's going on. Again, toilet paper, it doesn't cause any diarrhea, that type of thing. But maybe they're thinking they're going to be locked in their house for a month and can't get out, and they don't want to go out and use leaves or anything off the tree to wipe. But in the sense that they really want people to not spread it. So, but the unfortunate part is people, they already know how to do this. We've all had colds all our life. We know to cover our mouth. We know to wash our hands. It's doing the same thing we always did, but you just have to be a little more aggressive about it. And it's not difficult. It's very simple. Just wash your hands a lot. If you are coughing, wear a mask. You don't spread it to somebody else. And if you're around people that are coughing, probably wouldn't be a bad idea. At least now, that's probably not overreacting to have a mask in your pocket.
Yeah. Well, the mask is something that's interesting, right? So I was back in Florida. Well, I was in England really when I first kind of started watching the news. This is a couple weeks ago, and I went down to Florida, and flying home, people are wearing masks. People are like wrapped in plastic wrap, and one of the episodes of this other podcast that I listened to, it talked about the different masks and how important it is to not overreact and buy all the masks up. So your team, like example, your team in the hospital, they can't get masks when sick people are coming in, because then that perpetuates it. And then also how important with this type of thing, for the mask to work properly, you have to have almost like a custom fitted mask, and what you might wear in the operating room or whatever is more for you transmitting something to the patient than it is the patient to you type of thing, correct?
That's correct. Yeah, the N95 mask is the one that's recommended for this, and tuberculosis and several other things to keep from getting it, because it keeps you from breathing it through the sides. And it's fitted in a sense, but it's there are several sizes, but it's not that complicated. If it's tight and you can't breathe through the opening, you're okay. But yeah, now you can't. I mean, even the hospital's running short on these things for us, so it's kind of frustrating that people buy cases and cases. They don't really need them, but I guess the American way is more is better, right?
Yeah, we're trying, right? I mean, I have no symptoms as of right now, and so I wouldn't go get tested. But if I was going to freak out about it, I'd be like, oh, okay, I'm going to go get tested. So now I've wasted a test position or a how would you put it? I've wasted that time on myself when I don't need it, when somebody else might need it. I guess the resources maybe would be a good way to put it.
Right. Well, the hospitals are gearing up, and I know at ours we have it's just getting finalized this week, but there's a room that's going to be like a kind of like a hazmat room per se. So when you check in the ER, if you say I'm going to go to the hospital because I'm coughing, I have a runny nose and a little bit of a fever, they're going to check you there. And if you have any of the risk factors and have high fever, you're probably going to end up in that room until you can be tested. That's unfortunately, the flu is still out there. We're still, as of now, we're still seeing flu patients. So you could have a simple flu, you could have a simple cold that's just with a little bit of a fever. So right now we can't, unless you get tested, there's no way to know. But personally, myself, right now, I'm looking at the map here of California, and we have almost 500 cases, but it's sporadic out in the area, and almost all those cases are right now have some type of degrees of Kevin Bacon to somebody that was traveling, so if you've never traveled to your house, all you went is to Costco and back kind of thing, your chance that you have just a simple flu or a cold is more likely, but unfortunately now the hospital is going to take it probably a little more serious, and if you have a high fever, you have a chance of being isolated for 14 days.
What happens if you get the virus? Like if you, let's say I get and I test positive for it and I get sick. It seems like from what I've been reading and listening, watching, that I should be able to handle the virus. My immune system should do what it's supposed to do, last for a week or two, and then I'm good, right? Or no?
Pretty much. That's like they're saying 80% shouldn't have a problem, but it's just like the flu and like even simple colds. If you're 90 and, because of that, your immune system's already kind of decreased, and as we were joking, things get worse as you get older, and your immune system doesn't work any better either. So the very, very young and the very, very old, even in flu season, it's the same thing. Those are the people that have the poorer outcomes. So, but if you're a healthy kind of guy and you have a good immune system, it's going to hit your respiratory. You get a lot of congestion and coughing and nasal stuff like a regular cold, but it's what it turns into after that. That's the problem.
Wouldn't that happen if you got a bad case of the flu, of some other strain of the flu? What makes this so different? Just because it's new?
Well, like saying that COVID-19 now, it's a novel virus, they call it, meaning when they look at it, it's got, if you look at the proteins on it, they're real spiked. It's kind of neat. You can look at it from motocross terms, even like spiky tires, but it's got the coating on it, the protein coating is very sharp in the sense that it attaches easier. So it's much easier to get because of the way you breathe it in. Other ones, you may get a couple little molecules and you can sneeze them out, and for some reason your immune system just gets rid of it. This kind of latches on when it gets in you, so it attaches easier in that sense, and because your immune system doesn't recognize it as well, it allows it to grow faster before it starts trying to turn it off. And then with regular colds, it might take 5, 6, 7 days to a week to get rid of it. And in this one, it's going to take maybe a little longer. But at the same time, if your immune system just can't hack it, then you start getting pneumonia. Actually get to the rest of your organs, your kidneys, livers, things like that. And that's where everything starts to go really south.
But the average person with a normal immune system, basically speaking, should be able to handle this. We're talking about the edges of people that have pre-existing health conditions, and like you said, maybe like babies or even older people, elderly people. It's
like the other stuff, but in this case, we have a really high death rate, which is concerning. It's up to 10% or so, but initially too, it hit a lot of nursing homes. It seemed like, I don't know, not sure why they got it as far as, but they're all within people that came to visit who had been to China or one of those outlying countries. So we had a lot of people that are in nursing home that got really decimated. So that kind of added to the percentages. So once we see it get in the wild, as they call it, back in the whole U.S., say, if everybody's got it or getting it, it's like any other cold or flu, then we'll get a better handle on what the true, unfortunately, death rate or severe illness rate is going to be. But it could be higher.
Is there any part of the population that isn't affected by this, that can't be affected?
You may have a natural immunity. There's people that just get lucky and have a natural immunity to something, no matter what it is. We see that all the time. It's someone's around someone with some horrible virus and they've been taking care of them for a week at home, and no, I'm fine, I never got sick. So you just get lucky. But other than that, there's no way to know. And until they get a vaccine, which luckily, viral stuff is happening a lot faster than it used to as far as research and getting somewhere with the vaccine. So, but I still think it won't be within a year that they'll have a vaccine.
At first, I was maybe the first news that I got. I heard that it was only affecting men and it wasn't affecting women, and then oh well, a couple of women have gotten, and then it was like kids aren't being touched by this. Is that fake news or is that true?
Yeah, pretty much. Yeah, because right now it's just because where it's such a small population that it's just like any studies. We talk about injuries and things, and you need to have a lot of injuries to look at the numbers to prove it's not just by chance. So it's just by chance whoever got it the first time might have been a bunch of guys and traveling, and they started spreading it to their buddies, and so it makes those numbers look a little higher. But once we get it out to the millions, then you'll get a better idea of what really is, who's getting involved. And I don't see why it wouldn't be everybody. Yeah.
How much worse do you think this will get? Where do you think when do you think we're gonna see the high water mark for this?
Yeah, well, most epidemics or pandemics, they call them, it's generally 3 or 4 months. So I'm hoping by the summer, if things start panning out and it reaches a peak. But again, this is kind of a novel virus, so it's hard to tell. We'll have to a lot of this we're just kind of guessing because it's brand new to all of us.
As we're both scratching our face,
I
did wash my hands. Do you not trying to get political, but do you think that the Trump administration and what they've done with allocating funds towards testing and all of that is a good, have they done the right thing?
Well, the money always is what you need because you need people to start doing research, and they have they have to get paid, so to speak, and equipment and everything costs money. But a lot of it's just allocating it to the people that need it, who are sick and can't afford care, and we're back to the healthcare issue too. But it's all about how much you can get out and how quickly. And I don't know if, because of budget cuts, whether things are as fast as they could be. It's hard to say, but I mean, they did seem to jump on it pretty quickly and start things rolling. It's just the concern is it too little, too late? And with these viruses, we've been talking about this for years that there's going to be something out there just like HIV and AIDS was out there, and it took them 10 years to get that under control. But it's just now that we're geared up for it, I think things will happen faster.
Okay, well, if the fans aren't able to go to Supercross for whatever reason, would it be true to say that it would be a good idea to get out on your motorcycle on the open road, go ride in the trails in the mountains, out in the desert, go to your local motocross track? Would that be a safer place than going into a large group of people?
Yeah, exactly. I mean, the idea is stay away from people. Now, obviously, riding, you got a helmet on, but don't hang around with your buddies afterwards coughing and sneezing probably. But a group of people is the problem. I mean, on the airplanes you see people all the time coughing and sneezing, and you're in an incubator in a plane. That's probably one of the worst places. But just get out and have fun. And it's not here yet, so it's coming. But you probably got a few weeks of riding in before it gets too bad. Well,
okay. So any last little nugget that you think that we need from you on this?
Yeah, like I say, it's real common sense. If you get out there, don't freak out. If you get a cold, you've got a cold. But it's more the fever in this condition. It's pretty much everybody's getting a high fever. So if you have 102 temperature, I would say you take Tylenol, Motrin, the usual thing for fever. Keep yourself hydrated. So you're not getting, that's the thing, you're coughing, you're sneezing, you're losing fluid, so keep yourself hydrated. If you just feel like you have a cold and you're feeling well, I would still probably self-incubate, at home. Don't go out to any bars and restaurants and places, just stay at home. If you're feeling worse, then obviously go to the hospital, and they will probably keep you there for a few days if you need to.
Well, Dr. John Bodner, I appreciate your expertise, and like I said at the top of the show, I've always considered you the health and wellness expert for the sport of Supercross, and I always trust your opinion and your expertise and your knowledge on this. So I appreciate you doing this special episode of Real Talk 447, and I see all those helmets in the background, so hopefully you get a chance to go ride here if you're not going to Supercross.
It's raining right now pretty heavy. I'm not a good mud rider, but we'll definitely be drying up soon. But thanks for the kind words, and stay healthy out there.
All right. Thank you, John. Appreciate it.
Take care.